Well, we'll get started then. And as folks continue to come in from the waiting room, we appreciate all of you joining us for our quarterly DHS OCI Healthcare Coverage Partnership Forum. These forums are an opportunity for our agencies. I'm with OCI, Sarah Smith, to be able to share our updates, and also for all of our work groups to talk about the work that they're doing. For this meeting, we are structuring it with a bit of an update about the public health emergency unwinding. And then we will get into a couple of different topics, planning ahead to the fall open enrollment period. And then we are going to have a bit of a preview of the October forum. So that's something new we haven't done in these forums before, and we're hoping it will give us an opportunity to give you a sense of what we think will be important to talk about come October 24th. But also to hear from you all what topics you'd like to see us cover, or information that you'd like to see shared with stakeholders like yourself at that meeting. And then, as always, have general time for questions and feedback at the end. So I'm going to jump to the first topic so we can keep this going and be mindful of everyone's time. So as part of our public health emergency unwinding update, we're going to hear some updates from the Department of Health Services and from the Workforce Work Group. So first, I believe I'm handing it to Ruth to give DHS's update on the PHE unwinding.
Yeah, thanks, Sarah, and hopefully you can hear me okay from the home office today. I'm Ruth Sullivan. I'm the Deputy Medicaid Director and have some updates for you all today on where we're at generally with PHE unwinding, and then some specifics on how DHS is thinking about our messaging strategy for the unwinding period. So if you could go to the next slide and the next one. Thanks. So always like to start out with a little bit of a level setting of what we mean by PHE unwinding, just in case anyone is new to the term, which is probably not most folks in this group, but just the PHE refers, of course, to the federal public health emergency related to COVID-19, which was first declared in 2020 by HHS and has since been renewed now 10 times. The current PHE is set to end in mid-October, but states have been promised 60 days notice prior to the end of the PHE. And given we did not receive that notice in August, we are assuming there will be at least another extension of the PHE. Of course, this matters because the PHE, along with related state and federal legislation, has been what's allowed a lot of temporary flexibility for providers and also for our Medicaid program. And why we use the term unwinding is really because this is the term that CMS has coined to describe the process that states will undertake when the PHE ends and we're undoing all these temporary policies. So unwinding was not our term, but it has become part of the national conversation. So we've been using that term as well. You can go on to the next slide. So I think, there were many temporary flexibilities, of course, that have been in place during the public health emergency, but one that has had the highest impact, and so we'll focus on right now, is the continuous coverage for Medicaid members. And FCRA, that was the Families First Coronavirus Act, that's the acronym on the screen, put in place this continuous coverage requirement to ensure that people had the health care that they needed during the pandemic. And this is the federal legislation that's also tied to enhanced federal matching funds that Wisconsin has been receiving throughout the course of the public health emergency. And also worth noting, the related state authority there too. In the spring of 2020, the Wisconsin legislature passed this legislation as well at the state level to enable us to maintain this continuous coverage for Medicaid members throughout the course of the federal public health emergency. So if we go to the next slide, we'll talk about, of course, then what happens to this continuous coverage requirement when the public health emergency ends. So want to talk about how once the public health emergency ends, the earliest that anyone would see a change in their eligibility in Wisconsin would be the month, the end of the month after the PHE ends. So that would mean a January end date. We would see a first changes in eligibility in Wisconsin occur in February. We'll be looking to distribute our renewals that would happen over the course of the PHE unwinding period over a 12-month period. And so that will represent about 50 to 60,000 cases subject to renewal each month throughout the post-PHE period. I'm going to go on to the next slide. So I think we've shared information about this in these forums in the past, but want to emphasize again that we're really looking to simplify the process for members through aligning renewal dates within the household with other benefits programs as we set up those renewals over the year after the PHE ends, and also really looking to evenly distribute the workload across the year after the PHE ends. You can go on to the next slide. So just want to recap where we're at with the current state in assuming that there will be another extension of the PHE, putting the next potential end date in January. Our federal partners have confirmed that that assumption is accurate. So that means mid-November. So after the October form of this group takes place, but mid-November, we'll be watching to see if we receive that 60-day notice. And just want to continue to share our appreciation for all of the work. This is a huge collaborative effort. And with each extension of the PHE, we've been working with partners to use that time to really improve upon our plans. So we'll certainly be doing that in the months ahead as well. And now I just have a couple of updates on our messaging strategy. Thank you. So how we're thinking about messaging right now is really in 3 phases. And of course, right now we're in that first phase of before the PHE ends. And the most important messages for members to hear right now, and I think this is particularly important as we look ahead to open enrollment messaging being out in the world. We want to make sure that members know that they have coverage still. Their coverage is continuing until they hear from us. And that we need them to keep their addresses and contact information up to date so that when changes are coming, we're able to reach them. And I think, as each extension has gone on, there's been a little more opportunity for confusion or assumptions to be made. So we're continuing to get those messages out in the world right now. And then when we receive that 60-day notice is when we'll kick off this phase 2 in the middle there. And really the messages there will be, your change is coming, please watch your mail. You're going to receive a very important letter that will tell you what you need to do. So we'll be looking to spread the word there about what members can expect to hear from DHS about. And then during the unwinding period, there'll be a whole series of regular messaging that's tailored depending on the member's renewal date and their status, and really focused on reminders about renewals through text and emails as well as the mail, and also helping to share information about how members can transition to other kinds of healthcare coverage if they need to. You can go on to the next slide. Thanks. So want to emphasize again in this messaging phase that partner collaboration is very critical in terms of letting members know what's happening and keeping them informed and wanting them to hear from trusted partners who they're used to hearing from in their life, to be the ones alerting them that this is happening. And we'll be certainly leveraging our close partners and HMOs and IM agencies in this work, as well as covering Wisconsin. And we'll also be needing broader community partners to help get the word out about this. So to that end, always want to take an opportunity to plug on the next slide the Partner Unwinding Toolkit on the DHS website that has all kinds of tailored resources to help in sharing this information, flyers, social media graphics, text messaging, language, newsletter articles, anything that you might need to help spread the word about this unwinding is on that toolkit. We can go to the next slide. Thanks. So really brief, wanted to share since earlier this summer, we made some updates in the My Access app where members can manage their benefits through their smartphones. That is helping us to keep people's addresses up to date, where we've added in a prompt for confirming or updating your address, and seen a lot of great uptake in that. Since it went out, over 30,000 members have used that feature so far in the last couple months. So we're excited about that and just want to continue to keep encouraging members to use this online app to manage their benefits, to help just keep it accessible and also secure, and make sure that they can get the help they need when they need it. We can go on to the next page. I just have 2 more slides. I apologize for taking more than my allotted 5 minutes. Wanting to share just a look at our current social media messaging on unwinding, and then what will be the future messaging when the PHE unwinding begins. So our current messaging is really focused right around getting addresses and contact information up to date, making sure, at one point it was sort of give us your current address, and now it's really about keep us up to date. You may have moved multiple times in the last 2 years, so make sure we are kept up to date if anything changes. And then once the PHE is ending, go to the next slide. Our focus there will really be about, watch your mailbox, be ready to take action, and know that change is coming. It will have been a long time for some of these members, but so wanting to make sure that we're really encouraging people to watch that mailbox, read the letter when they receive it, and take action. So it'll be a call to action focused message there. All right, I think that's just about the end of my slides. I'm going to go to the next one. We've just got a reminder of all the places you can find DHS social media. We'll be posting various pieces of reminders and messaging about unwinding. And then I think the last slide just has a email box where we're always collecting questions. If anyone has them on unwinding, that's a great place to go. Encourage partners to send any questions there, or individuals as well. And I think that is what I have. Sarah, thank you for being gracious with the allotted time. My team wanted to make sure we shared some of that messaging.
Yeah, absolutely. Thank you, Ruth. Appreciate that update. And those on the call, do take that email down and reach out if you have any questions for Ruth. Next, I believe I'm handing it over to Bobby to talk about a couple of quick updates from the workforce work group on direct assistance and workforce capacity.
Yes, thanks. Can you hear me?
Yep.
All right, great. So this is an update, the work group update for access to healthcare and coverage issues that direct assistance and workforce capacity have worked on. And just give you sort of the same sort of drill that Ruth went through, a little bit of a level set. So let's go to the next slide. We were formed over 2 years ago now to work on some guiding principles, improving access to healthcare, coverage, reducing disparities, promoting wellness, promoting equity. And those were a lot of the activities that the work group looked at and worked on over the course of about 18 months. But now over the last year, we pivoted in preparation of in response to COVID, but also in preparation for the end of the public health emergency. And so let's go to the next slide, please. The recommendations that we had previously developed were to create a virtual consumer assistance hub. This was a concept that we spent many months discussing and working on, thinking about how could we provide better services across the state to consumers across the spectrum of marketplace, Medicaid, and other services to help them navigate and connect to services with different levels of assistance potentially. So that's a recommendation, and that still is out there as a recommendation from the work group. The second recommendation was creating a virtual workforce training portal. If we're going to be establishing a consumer assistance hub, then we need to make sure that people are adequately trained, not all at the expert level and not all at the very basic level, but sort of a continuum of sort of mobilizers all the way up to more expert level assistance. And so that still is a recommendation. It looks at a lot of different types of training portals that DHS uses and other organizations, thinking about how we can provide ongoing training, continuing education, and build competency and capacity of the workforce, but also do some things like measure existing levels of understanding so that we can target and tailor training. So that's another recommendation that we developed. Next slide, please. But currently in 21-22, when we've pivoted, we've been working more on a specialized work group activity partnering on the IM partner work group. And this is really important work. We heard Ruth talking about some of the expected changes that we're not sure when it's going to happen, but likely in 2023 now. We don't know that for sure yet, but there will be a pretty big sea change for a lot of folks in Wisconsin, and we want to do everything we can to be prepared to understand the issues, the responses, and how to best facilitate not only referrals to IM agencies, but help enrollees and customers that are pivoting between Medicaid and Marketplace. There's big changes that occurred out there in the landscape over the course of COVID. People gained jobs, lost jobs, switched jobs, increased income, lost income. All those will have an impact on their eligibility moving forward. And so all this has to be resorted out, and people are going to need some help navigating and getting to the right resources at the right time. So as Ruth said, I think 50 to 60,000 per month are expected. This isn't all going to happen at once. There will be some early activity that happens, but this is a big deal. And if your healthcare is changing and you really haven't had to do anything for the last 2 years, this is going to come as a bit of a surprise. And we want to make sure not only enrollees or potential enrollees, but the workforce is also ready to respond to this and are able to help people and deal with these changes and make sure we don't lose people. Because that would be a loss for all of us if we ended up having people that ended up losing their healthcare coverage. We've really done a tremendous job in making sure as many people are covered as possible. And this is really our a major attempt to make sure we keep people connected. So the IM Partner Work Group, it's a group of folks that include IM agency staff, state staff, advocates, and others that are working really to troubleshoot issues, identify some best practices, think about strategies that we can do to help people stay connected, education, frequently asked questions, and the work group meets regularly. Our next meeting is tomorrow, and we are still encouraging folks to participate in that. A lot of the members of the original Workforce and Capacity Work Group have pivoted over to this work now. And there's an email that the Forward Partner inbox. If you're interested in participating in these efforts, I would strongly encourage you. If you think you have issues to share, best practices, this isn't kind of a ride-along meeting. This is an actual work meeting where you need to come up with recommendations and suggestions and questions and strategies about how best to help people that are going through some of these transitions over the next year. So Maciel has also put the email address in the chat. So join us. It's a good group. We're making great progress and we're coming up with some really important ideas so we can be ready when the turnovers occur. Thank you.
Thank you, Bobby. And thanks, Maciel, for throwing that in the chat. So now we are going to move into looking ahead to open enrollment. So the first topic on open enrollment is enrollment assister capacity. And I will hand the reins over to whomever at Covering Wisconsin is taking these slides.
Thanks, Sarah. This is Allison Esposette, the director of Covering Wisconsin. So I'm going to handle this section. Great to be here today. And so I wanted to just share as we look ahead to open enrollment, which is starting November 1st and continuing through January 15th again this year. That was the expanded open enrollment timeframe that happened this past year and will continue for this forthcoming year. Taking a look at the enrollment assister capacity. So first is Covering Wisconsin is Wisconsin's health insurance navigator agency. Just wanting to make sure people recognize the role of navigators in the state. The navigators work year-round, not just in helping consumers to do direct enrollment assistance, but really being proactive in the community to do outreach, promotion, really just providing awareness and education, the holistic approach to helping people not just get health insurance coverage, but use that coverage to then get the care that really is the ultimate goal. Navigators help with badger care and Marketplace, Medicaid, and really just, like I said, not just with getting access to coverage, but coverage problems, appeals, billing issues, you name it. So next slide. And the navigator service area this is going to continue to expand in the forthcoming year as we continue to add additional navigators, both from our support from the Centers for Medicare and Medicaid Services, but also in anticipation of the PHE unwinding in the coming year, really trying to add more navigator capacity to support consumers around the state. What you see on the map here is the current navigator service area. We cover the entire state, and navigators both, it's a dual role of both being able to help consumers anywhere in the state over the phone, but also this focus on that local assistance. We know that consumers really appreciate navigators who understand just what's happening in their community, the health plans, health systems that serve their community, the particular issues that they might be seeing in their community when there's employer layoffs or just other changes that may be happening. And you also see on the slide the agencies that we subcontract with, as Ruth was mentioning, that local trusted partner we know is so important. Folks may not understand or recognize the Covering Wisconsin name, but they may recognize a local community agency that has been there serving their community for many years. So next slide. And there are many other kinds, other kinds of enrollment assistors. In addition to navigators, there are certified application counselors, also known as CACs, as well as, of course, agents and brokers, which have long served for helping people with enrollment into health coverage. So it's important that it's this whole network of other kinds of enrollment assistors that we, especially Covering Wisconsin as a navigator agency, really tries to work in concert with and in coordination with. Next slide. So how do you find an enrollment assistor? That's the most important piece. And there's many ways, including one expanded way that we are trying to make finding this help more accessible and easier for consumers and professionals, the professionals that support them, including all of you. And so there's online, which you can go to what is called the connector tool at coveringwisconsin.org/enroll. And there you can enter in a zip code and it'll show, and depending on the range, the mile range that you want to put in, it'll show you the different kinds of support that is available in your area. In addition to that, good old-fashioned phone call always works, both a direct call to either Covering Wisconsin or the 211 helpline through United Way. And we work very closely with United Way 211 to make sure that they have the same information that is on the connector tool, up-to-date listing of health insurance enrollment assistors who help with both Medicaid and Marketplace. And so if you actually are interested in making sure you're on the connector tool, you do provide both of those for free at no cost to consumers. Please do reach out to us and we can take a look at that. And then finally, the new way that consumers can act, and again, professionals, anybody can seek out help in both getting an appointment or just if you have questions, is this new live chat tool. As people are just becoming more and more wanting to use online services to be able to communicate with customer service type services, then we knew that we needed this kind of live chat feature. And it rolled out. We've been doing a slow rollout as we just tested, as we're testing it, and most recently have just added a Spanish version. Both of them are available on the Covering Wisconsin website as well as WisCovered. And there's an opportunity to both chat and as well as to actually talk to somebody live. For the English version, for Spanish, it's still being still limited to the chat, the automatic texting chat only. But we hope that you'll check it out and share that information as a new resource. Next slide. And for really anybody who is involved in any aspect of an open enrollment, either doing the direct enrollment assistance, supporting folks who are doing enrollment assistance, doing outreach. The Wisconsin Health Insurance Enrollment Conference has been held every year since the beginning of the marketplace, and it's a place for enrollment assister community types of all kinds to come together and learn about the latest policy, program changes, definitely ideas around outreach and reaching folks and raising awareness. We continue to hold it virtually, as we know that this is the most effective way to bring in all of the enrollment assistors around the state and make sure they get access to this information, as well as receiving the continuing education credits that are required for navigators, CACs, and agents and brokers each year in Wisconsin. You can see the dates on your screen there. Pre-licensing, which is for those who are new to becoming a enrollment assister, that starts mid-September, but then for everybody else, September 28th through 30th and October 3rd and 4th, those mornings only. And again, like I said, it's virtual, so no cost to attend. We encourage contributions, but we really encourage anybody who's interested to please attend and to register. And then next slide. And then finally, I wanted to also share another way, both for open enrollment as well as when we look ahead to the unwinding. How do we try to further encourage coordination among enrollment assistors around the state and regionally, better access to sharing information, tips, brainstorming, troubleshooting, and cultivating a referral network for different services, enrollment networks. So back when the marketplace first started, regional enrollment networks were created just to help build those initial communities of understanding around the marketplace and understanding about how to serve consumers in the best ways possible. And now with the PHE Unwinding, looking to bring those back up to speed and making sure people are talking and connecting as much as possible. And we're very excited to show you that there are now enrollment networks serving all of the state, including one that is statewide and is the Latino Enrollment Network, to support all the enrollment assistors who support consumers in bilingual Spanish. And you see on the map here the different enrollment networks, and Caroline Gomez-Tom is the Enrollment Network and Accessibility Manager. And if you're interested in joining and being connected, please do reach out to her. And next slide. And so you'll see here all the lovely folks who are leading the different enrollment networks. I'm sure some familiar faces, maybe some new faces to you, all fabulous people. And so we're so thrilled to be having them. They're all up and running. They all had their kickoffs just recently. Some actually have been consistent ever since the beginning of the marketplace. And so lots of really great resources out there. So I do encourage you to join. And I think that is the end of my section. Thank you.
Thank you, Allison. I guess I'll pause since I did see in the chat a question about questions. If there are quick questions for the presenter, you can always put questions in the chat as we're going, and we can try to get those answered in the meantime. But there is a general section at the very end for questions and feedback. So if you have, mulling some questions over, or if you have some more high level, big picture questions, we have a section at the end to talk more about those. And I don't see any other specific questions that had come into the chat necessarily for Allison. So it looks like Bobby or Ruth. Great. Thanks, William. So then we are going into the marketing and outreach portion of the open enrollment section of our forum today. And the first slide here is an update from us at OCI. So some of you might remember, and I've probably talked about it in every one of these forum meetings for about a year now, that we were awarded a federal grant in the amount shown there, the $689,000. We got that grant awarded last fall, went through the RFP process, found a great consultant who's been working on reports for us. And the main impact for the fall open enrollment period is that we've gained a lot of information from the market analysis that we have conducted as part of this grant. So the intent of our market analysis, otherwise known as the market scan, was to give us a snapshot of the current state of enrollment plans, get a better understanding of uninsured consumers, get a sense of what is informing the choice to stay uninsured, what informs their choice when they're choosing a plan, all those things, so that we can target our marketing and consumer education efforts really effectively from our agency. And it's already internally informing the development of our open enrollment marketing campaign that will be able to utilize about $245,000 of the total grant funding shown there on that marketing campaign. So that will be a significant investment that will be able to make an encouraging enrollment this fall. We are waiting for some approval with CMS to be able to share the details of this report publicly. But we're in the process of finalizing the details of that to be able to share it with you all. And we hope we'll be able to do that at the October forum in more detail. But this is just to give that quick update that we have completed generally the market scan portion of this federal grant that we were awarded to conduct a series of 3 reports actually about the state of the insurance market, the health insurance marketplace in Wisconsin. So that's our quick update. And now I believe I'm handing it over to Stephanie to talk a little bit about some of the other, or maybe Courtney, I've lost track, I apologize, about the marketing and outreach work for open enrollment and the planning that's already been happening.
Yeah, thanks, Sarah. I'm gonna start us off. So I'm the co-chair of the marketing work group, and I wanted to talk a little bit about what our goals are to sort of understand what we've been doing, to give you a little bit of expectation setting. So we are a group of stakeholders who all come together and we co-create key messages and strategies that we hope will inspire action among consumers across the state. And sometimes groups within our marketing work group try to consumer test a lot of these messages to see how they'll play within different communities or consumer groups. So part of the reason we're co-creating and working together is that we can have a coordinated marketing effort come open enrollment. We don't want to see 5 different groups advertising 5 different messages, telling people to do 5 different things. We're all working together to get people covered. So we want all of our marketing efforts to support that. And as Sarah mentioned, they're going to have some marketing dollars to invest. So we want to be able to make sure that whatever Covering Wisconsin might do, or Milwaukee Healthcare Partnership, also MCAN might do, we all support each other and where those dollars are being invested. So we don't all put money in the same thing, so we can spread it around evenly amongst the state. And then we're also really thinking about those target audiences. Something Sarah just mentioned is, who are we talking to in our marketing strategies? Okay, next slide. So since the results of the scan have not been publicly presented yet, we're still moving forward with some early open enrollment preparation. And one of the things we know is that enrollment assistors are out in the community now, starting now, to really get the word out to the partners and agencies that they work with. And so we need to get materials ready for them to share around in their community. So we're really working on key messages and also thinking about statewide, and also funneling down to more targeted promotions for particular groups, like say people who may want to retire early. And then we're starting those toolkits for community and social media outreach. We'll talk a little bit more about that. And there are 3 that are created statewide. That's Covering Wisconsin, OCI, and Healthy MKE. All have publicly available toolkits that you can download and use materials in your community. And you can also personalize them. The other thing we're working on are scripts for TV and radio public service announcements, which have been really successful, we have found. I'll talk a little bit about last year's campaign. We're also thinking about videos for social and digital media campaigns. That's really your digital streaming TV or YouTube. We're thinking about audio tracks for streaming audio ads and creative for other large media buys such as bus placards or billboards and stuff like that. Some of the more traditional media buys. So we're all going to work together and we're thinking about this and we're coming up with messaging. So some of the early messages that we've developed, we need to get some materials out into the community starting now to let people know open enrollment is coming. And here are some of the early messages. Healthcare is self-care. Get health insurance and take care of you. We found that to be a fan favorite amongst enrollment assistors. And we have a variety of images to go with that message to really be inclusive so you can put them in different communities that you may be serving. Your health is wealth is a hook that is going to be used widely in different ways. So I know that Healthy MKE has a large marketing campaign planned with that message. They're going to have a different, with that hook, they're going to have a slightly different message or a different message to go with that. But when we're thinking about maybe generational families, we're talking about get health insurance and be there for important people in your life. So, you know, we play with a lot of these. Another hook is need help paying for healthcare. We can help you find free or low cost options. Here we're trying to get at the people who may not have considered health insurance, or maybe they think they can't buy health insurance. Maybe they just assume it's too expensive, or they've never had it. They don't really understand what it means or how it works. And so really just getting at what do you need? You need healthcare. So let us help you find ways to pay for it. And really an opportunity to speak with an enrollment assister to be educated about what's available. And then thinking about the early retirement community, dreaming of retiring early, explore your health insurance options so you can explore your passions. We're also trying to play a little bit with more humor this year. So we thought this would play well with some audiences. Accidents aren't always funny. Get free help to find health insurance. We have a bunch of fun ideas for a targeted video campaign with fun sort of, you know, accidents. A lot of people like to watch those cute little accidents type shows where there's clips. Another one, owies aren't always cute. Get free help to find health insurance. Really thinking about that family. A lot of parents tend to prioritize health insurance for their children. And so it's a nice way to start the conversation. Okay, so once we have some ideas of some key messages that we're starting to use and put together, we take those messages and we create outreach materials such as the toolkits. We encourage different groups such as the education work group or CACs and navigators to use the messages more broadly in their own outreach campaign. A lot of navigators might send emails, like large amounts of emails to people they've enrolled in the past. It helps inform the creation of radio, TV, and social media ads. And also we get inspired by the ideas to come up with different videos we can use in social media for using these messages, or targeted streaming and digital ads. Okay, so I wanted to talk a little bit about the Wisconsin Broadcasters Association campaign. We have found this to be an extremely successful way to reach a lot of people in the state. So this is a public service announcement style campaign that's only available to nonprofit or government entities. And it's really, you're placing an ad buy that works with 95% of the markets in Wisconsin. So I wanted to talk about last year's campaign. It was extremely successful, and, you know, to enroll people. And we think that this large ad buy of 10 weeks was one of the reasons it was so successful. So I'll just start off with saying that I think it was over 212,000 people enrolled in plans on healthcare.gov. It was the highest amount since 2018. And we found the campaign directed people to go directly to Wiscovered or Call 211, and just Wiscovered had over 7,000 sessions. So we feel pretty confident that this strategy is very much working. So what do we get with this ad buy? Oh, let me just first mention, this wouldn't have been possible the whole 10 weeks without community support. So we had a lot of stakeholders chip in so we could get to those 10 weeks. Because groups who are funding these campaigns are often grant funded. So we have limited dollars. So I just want to call out everyone who helped contribute. That was Common Ground Healthcare Cooperative, together with CCHP, United Healthcare Community Plan, Security Health Plan, UW Health, Robin Health Partners, Network Health, Aspirus Health Plan, and then Covering Wisconsin with funding from CMS and the Wisconsin Department of Health Services. So thank you everyone for your support last year. So last year we had over 13,000 radio ads on 176 stations, over 3,000 TV ads on 36 stations, and that did include some digital streaming via stations like Hulu with the local channels. That campaign only cost us $95,000, but it was a value of nearly $600,000. The reach, according to Nielsen data, is that in just a 1 month period, you're reaching over 1 million consumers via TV and over 2.5 million over radio. And if you look at then the impressions over more like a 2 month period, we're looking at over 7.5 million for TV and over 11 million for radio. And then it had a social media reach of 631,000. So we're very happy with how this campaign played out. So we want to do another one. You could go to the next slide. So unfortunately, it's an election year, as I don't think any of us don't realize with all of the campaigning going on. So we're going to start after the election. So that would be November 14th. And so we're going to aim for 10 weeks of ads. Again, that would take us all the way to January 15th. We're looking for help to support this initiative to get to those 10 weeks. We have enough to get started, but we're not going to be able to pay for all 10 on our own. And so far, we already have a commitment from Common Ground Healthcare Cooperative, OCI, and UW Health. So, you know, Covering Wisconsin is the one who purchases this particular ad buy. And so you might be receiving some letters asking to support us, or certainly feel free to reach out to me or Allison Espeseth if you are interested in supporting us. Okay, next. Okay, other ways to support the campaign. And I know Courtney's going to talk about some of these things, but if you follow OCI, Covering Wisconsin, or Healthy MKE on Twitter and Facebook, we often post, and then you can share those posts. Like our posts, that really helps them go viral. Sharing and liking and viewing really, really helps us. And then we especially are hoping you can help us with the media ad buy for the Wisconsin Broadcasters Association. Part of that's a social media campaign. We post for them typically on Mondays. That'll start on November 14th. And if you could share those posts, that would be wonderful, because they share them on a bunch of the radio and TV stations, and it really helps it go viral if everyone starts sharing on the same day it's posted. Print and share outreach cards and flyers, which Courtney is going to talk to you about how to do. Share. So we have those toolkits available. You can just go onto the toolkit and pull off social media that you want to share and put your own words and content there. And then Healthy MKE, OCI, and CWI all have a listserv, or I guess Healthy MKE calls it a newsletter. So it's a way to stay connected to things that are going out and be able to know right when it's live. So there are links here for each of those listservs. Okay, and Courtney.
Great. Thanks, Stephanie. So like Stephanie mentioned, one of the really important ways that our partners can help us in spreading the word right away is by starting to use some of our toolkit materials. So Stephanie shared a kind of cross section of all of the different types of messages that are available in the Covering Wisconsin and some of our other toolkits. And on the Covering Wisconsin website, all of our materials will be available, or most of the materials will be available in English and Spanish. The Spanish toolkit is not yet live, but it should be in the coming days. And like Stephanie mentioned, on those toolkits, there are some ready to use, just ready to download right from the website, social media graphics that you can then add your own post text to personalize it locally. But we also have printed outreach cards and flyers, and you can download and print those directly from our website that has the more statewide call to action of contacting 211 or using some of the kind of statewide contact methods like the new texting tool that Allison shared and the web chat feature as well via a QR code. But you can also contact us to personalize them, and I'll talk a little bit more about how that works in the next few slides. We also, of course, will have the OCI toolkit that OCI is putting together. We are fortunate, of course, to have had the Inflation Reduction Act pass recently, which extended the extra subsidies and healthcare.gov plans for this next open enrollment period and the next 3 years out through at least plan year 2025. And so the OCI toolkit will feature some messaging related to lower costs that those additional subsidies provide in the marketplace, and some of the Covering Wisconsin toolkit materials do as well. And that toolkit, you can go ahead and bookmark that website now for the OCI toolkit, and the full toolkit will be live on their page coming soon. We also wanted to just reiterate that although open enrollment is our focus right now and over the next several months, as we get into this fall, we also will continue to be working with the Department of Health Services to spread this public health emergency message and that updating your contact information message that is still relevant at this time. So just wanted to highlight again that DHS partner toolkit, and that some of those materials, as Ruth mentioned, can be customized with your organization's information. And Covering Wisconsin actually has customized some of those materials ourselves and have those online in our toolkit in a Badger Care and Medicaid section. So if you're looking for some materials that have already the contact information for Enrollment Assistors, you can use the materials in our toolkit or reach out to us to personalize them with your local information as well. And then the social media outreach is another great way to help support all of our campaigns during open enrollment and beyond. So like Stephanie shared, if you follow all of our accounts on social media, it's a great way to kind of quickly and easily spread the word yourselves, but also make all of our funded campaigns like that Wisconsin Broadcasters campaign that Stephanie shared go even farther. So if you are not already following all of our accounts on social media, we also include the healthcare.gov accounts here and a specific Spanish cuidadodesalud.gov account as well that is really great and helpful to follow during open enrollment specifically. And then just a reminder, I know we always talk about, and especially in this forum, that folks locally across the state really know best how to spread the word in their communities. Like Stephanie mentioned, our Enrollment Assistors are all out there locally already, talking with partners, figuring out what materials they would like, and getting started thinking about what community events will be available and other creative ways that we can spread the word locally. So I just wanted to highlight some of the ways that some of our partners have shared with us that they've spread the word during open enrollment in the past. Things like including outreach cards in food boxes or backpacks at back to school events, resharing or creating new social media messages, like I mentioned. We've also had a lot of success with other organizations adding web banners to their organizational website with key information about open enrollment, and then linking to WisCovered or the Covering Wisconsin website to find local help. We've found that to be a really successful way of getting folks to our organizations for assistance. And then things like placing an ad or article in a local newsletter. Partners even like the Wisconsin Public Health Association, like you see here, have worked with us on placing newsletter articles that then spread throughout their network and give some more tailored messaging for why it would be important to spread this word to others in your field. So whether it's you sharing some of this information directly yourselves or working with other partners in your network, there are just a lot of creative ways that this can be done. And you all know best locally what will resonate most with your your constituents. And then if you do have questions or need some materials, like I mentioned, all of our materials through Covering Wisconsin and many of the DHS materials as well can be personalized with local enrollment assister contact information. Or if you are a partner organization and are just interested in co-branding or adding your logo to some of these materials to help them resonate more with the folks that you serve, and refer them to Covering Wisconsin or another local enrollment assister as a trusted partner, that's an option as well. So please feel free to reach out to me if you want to discuss any of those options, or if you are interested in maybe talking about creating some additional messaging or materials you think might resonate more with your members. We also can help support you with printing materials. So if that's a barrier, please reach out and we can work with you on getting materials printed and distributed to you as well. I think that's all I have. Yes.
I was muted. Thank you, Courtney. All right, so we will jump into the kind of preview for the October forum. I'll just cover the OCI market scan report piece first, and then the folks from the data work group might want to expand on some of the things they plan to discuss at the October forum. But first, as I mentioned earlier, we are hoping that we'll be able to share more of the details and information from our market scan report, which will be informing our marketing and outreach efforts for the open enrollment period, but also, just inform our ongoing efforts to encourage enrollment by informing some of the ways that we talk to different communities and the particular communities that we need to communicate with to raise more awareness of healthcare.gov. We are also really focused, as you probably noticed, as we had that brief slide showing the outline of OCI's toolkit for the fall open enrollment period, that we do have a cost-focused message on some of our content. So we have a couple different audiences we're looking to communicate to, but thanks to the extension of the ACA subsidies, formerly known as the ARPA subsidies, but now I suppose the Inflation Reduction Act subsidies, but that were extended in the Inflation Reduction Act for the next 3 years and will be in place for this open enrollment period for the 2023 plan year. We're going to continue to do a lot of our communication with a focus on the cost savings that people can benefit from thanks to those subsidies. And that'll be a main focus of all of the materials that we're putting together for our communication effort, but we'll talk more in detail about how we're going to do that and based on the information we've learned in the market scan report at the October forum. So then, as you can see here, there are a couple of data points or a couple of bullet points from the data work group on some of the dashboards that they've been working on. So I don't know, I want to put you on the spot, Kelsey, Avery, do you want to expand on these at all? These quick previews for the October forum?
Sure. Yeah. So thanks, Sarah. We at the Data Work Group have been hard at work for quite a while to bring these two resources to fruition, and we are on the cusp, and it's very exciting. So we're really looking forward to being able to talk in more detail with you about these two resources that are going to be available in the coming months or so. The first one I just want to call out is a more general kind of public-facing dashboard. This is meant to be a year-round resource for stakeholders of all types. It incorporates a variety of data sources about insurance in Wisconsin, and that includes census data, includes Wisconsin Medicaid data, and also includes some new data that OCI has begun collecting on fully insured individual market and group plan enrollment that basically started during the pandemic. So we're really excited to roll all this out and make this available to folks, and we'll have much more to say about all of that in October. And then the Public Health Emergency Unwinding Outreach Communications Dashboard. If you attended this forum in May, I gave a little bit of a preview of that dashboard and sort of the purpose and what we're hoping to do with it. It is tied to the unwinding and supporting stakeholder efforts to keep folks enrolled in coverage throughout the unwinding. So again, we'll have some more details to share about that in the very near future. And we're really looking forward to putting these two new resources into practice with all of you.
Thanks, Kelsey. So on that note of these couple items that we plan to walk through and share more information about at the October forum, are there other topics that we should make sure that our work group chairs, some of whom you've heard of or heard present earlier in this forum, but also have heard at previous forums, are there other topics that would be useful for you in communicating with the audiences that you work with about healthcare coverage? And you can put it in the chat or probably just unmute. I don't think that would lead to too much chaos because I don't see a lot of people scrambling to unmute at the moment. And if you do have other ideas, you all can also feel free to reach out to me. I'm the one who sent the calendar hold that you all hopefully have. So you can always just reply to that, to email me if you would like to add any ideas for the October forum. I don't see anything coming in the chat other than a very nice comment from Julia. So appreciate that. And shout out to Covering Wisconsin for their information sharing. And that's my email address if you would like to. And we will jump to the questions and feedback section. This is why we keep these meetings for an hour and 15 minutes because we always run up to exactly an hour. So we have now reached the questions and feedback section of the agenda. And it looks like we have a question. It looks like Anne sent me a question about will the suspension of Medicaid for incarcerated persons continue? So I believe that's a brief question.
I might need a little more context on that continue.
Anne, would you be willing to unmute and expand on your question a little bit?
So previously, Medicaid in Wisconsin had a policy of terminating benefits when people were incarcerated. My understanding is currently there is a suspend so that those benefits can be reinstated when that person is released. And that took place in 2020. And I'm wondering if that was a result of the pandemic or something else, and if that policy will continue.
Okay, thank you for the additional context, Ian. I am not the subject matter expert on our eligibility policies, and the person who is unfortunately on vacation this week. So if we could take that back, and I know my colleagues, a couple of my colleagues, including Maciel, are on the call, and perhaps we can take that back and get back with you about the answer to that.
Do you mind if I take a stab, Ruth?
Oh, sure, go ahead. If someone else can answer it, even better.
Because I was on the other side of the fence in DOC when we developed it, suspension is not tied to the PHE or unwinding, so that
okay.
Policy will continue.
Thank you so much, Lars. That's very helpful.
You bet.
All right. Thank you both for tag teaming that. And then I don't see another question coming in the chat at the moment. Feel free to send questions to the chat, but I think William had a question earlier. So if you want to unmute and ask that question, go ahead.
Sure, thank you. So I'm wondering, and I think maybe this is a question for Bobby or maybe Ruth, but in thinking about the PHE unwinding and the income maintenance partnership work group, is there going to be some kind of regular kind of feedback mechanism or sort of huddle for anecdotal information, as well as the information that's going to populate the dashboard to kind of help inform and energize potential responses as the PHE unwinding actually starts and, you know, is sort of going through its 12-14 month process? Or if there isn't a thought about that, then this is a plug for having something like that.
Yeah, William, this is Bobby. I think that's part of the whole point of that work group is to collect information. Some of it may be anecdotal, some of it may be more, you know, information that's generated by actual, you know, client encounters or workplace encounters or workplace policies and things like that. So that, my understanding is that we're going to, you know, we're getting ready for it now, but we will continue to be able to collect that information and share that information. We're developing things like FAQs and other info, fact sheets and things like that, that we can get it out there. So at least from my perspective, the work group is going to be sharing that type of information. So, and you're welcome to join the work group too, if you want to, have an oar in the water with us on that. That's some good opportunities to learn about some of the best practices, learn about some of the issues and trouble areas that we see, and recommend, potential, recommendations for changes. This group isn't going to be changing policy, and so, but it will be looking at the current policies and trying to make sure that we can work the best within that framework.
Great. All right. Are there other questions? Again, throw them in the chat or unmute if that's easier for you. Great. Well, I'll leave this previous slide up for a second. Again, just to share my email address so that we can make sure that the October forum covers all the topics that you're looking for. So if you know any of these questions that you might have beforehand, we can prepare and make sure that we put some information together ahead of time to have it in our slides and walk through during the forum, in addition to the couple of topics that Kelsey, Avery, and I mentioned a minute ago. But if I don't see any other questions coming in the chat, I don't see anyone else unmuting, then I think we can wrap up today. And again, I appreciate everyone's time and engagement with us as we continue this work on increasing healthcare coverage. Thanks.